Neuroblastoma. Introduction. Are all tumors cancerous? Select yes or no. Correct. Only malignant tumors are cancerous. These tumors have the potential to invade other tissues. Benign tumors are not cancerous. What is the name of a tumor that invades other organs and body parts? Choose one of the following options. 1. Cancer. 2. Malignant tumor. 3. Metastatic cancer. 4. All of the above. Correct. Is it always possible to determine the cause of cancer in a person? Select yes or no. Correct. It is not possible to specify the cause of cancer in an individual. Does having a risk factor for neuroblastoma mean you will get neuroblastoma? Select yes or no. Correct. Having a risk factor for a cancer increases the chances of getting the cancer. It does not mean the person will develop the cancer. The only sure way to diagnose neuroblastoma is through a biopsy. Select true or false. Correct. A biopsy shows whether a tumor is benign or malignant. This is the only sure way to diagnose neuroblastoma. Is stage 1 cancer more dangerous and advanced than stage 4? Select yes or no. Correct. Stage 1 is less advanced than stage 4. This means it is usually more treatable. Treatment for neuroblastoma may involve watchful waiting. Select true or false. Correct. Treatment for neuroblastoma may involve watchful waiting. It may also involve surgery, radiation therapy, chemotherapy, bone marrow transplant, and biologic therapy. Some combination of these treatments may be used. Thank you for using Explain.